right, this is the adjusting technique. So whoever wants to get adjusted in about probably 15 minutes, I'll kind of put my word out there to who wants to get adjusted. Dr. Williams, whatever you want to do too. I remember from last year, I remember some of you guys, some people. My biggest thing with adjusting is before the adjustment, what's the most important thing we have to do as docs? Before we lie someone down, go ahead. Before the exam, during the exam, what do we have to do? What do we have to use our own personality, whatever it is, to communicate our message first, right? This is 2025. Still, people have no idea what we do as chiropractors. People think still we still give medications. We do shots. Some people think we do surgeries too. So we have to make sure patients know coming in the door the first time they come in, give them the first best impression, right? Okay. So doing that, we want to make sure, you'll see some examples of my adjustments for year two, what I do with my patients, some of my results also too. I've seen them last year, probably some of them last year. A lot of it is communicate our message properly, like what is the adjustment? How do we get there? How do we link their pain, their problem, their neuropathy to the adjustment giving them relief? How do most people do that? Teach them. Do you teach them through x-rays? You can. I take x-rays in my office. I'm an x-ray guy. You can teach them through examinations, like we talked about the assessments too, even diagrams and pictures. So you have to figure out almost, when I see patients for the first time, the first 5 minutes, I want to see how they learn, how do they respond to how I talk to them, what image I show them, how things work. I show them, for example, in my office, a normal x-ray of, say, their lower back pain, normal x-ray of a lower back. We go over, is yours the same or different? They go, I don't know, let's find out. I'll also go with them too, what problems are you having? Is it problems with just pain, or does it affect also your mood? How can someone's chronic pain, for example, affect their mood? How does that happen? Remember the fight or flight, how that works? And over time, as the body becomes more stressed, your hormones change. So more your body overall produces more problems to where your body just feels overall stressed all the time. So when you see someone with chronic pain, do you ever ask them, how do you sleep? Is that a common question? Why is that important? For me, it tells me, if they don't sleep well, I ask them then, okay, if you don't sleep well, during the day, how much energy do you have? Not enough. Okay. Sometimes do you feel stressed for no reason at all? They shake their head or they nod their head, yes. And they go from there, I ask them also, sometimes do you feel anxious for no reason? Say something that happened a month ago didn't bother you, now it's like, why does that bother me? And they go, sometimes shake their head, yes. So part of it is, as they go through those steps with your patients, can you see how deep that pain is in their body to let them know the adjustment over time can be effective to make them not only feel better physically, but indirectly help their mood, help their ability to relax more. So that stress response in their body can calm itself down. Is that more important to the person or just their pain? So we want to find out, is there a way for us to get them to understand the adjustment, but first of all, understand what it can actually do? Okay, so this is just a quick video. Where's my little thing here? A couple of my patients I showed last year too, a little bit of how results you can get. And this is why we do things, right? We want to help people. We want to help people feel better. We want them to feel better and over time understand the adjustment helping them feel better, not their medication, not their surgery, not their psychologist. It's because the adjustment made them feel better. All right, so a quick one here. Just a little bit.
Ever since I started coming to the chiropractors, it's made a difference in how I sit down at the desk and also how I work out. I'm able to have better position in posture, sitting down and doing exercises, squats, something that I've never done. But now I can do it thanks to the chiropractor.
When looking at all the locations here in Upland, your office had the youthfulness of the doctors that were here, professionalism that seemed to coincide with what you teach here.
And by coming here,
crazy.
I was able to enjoy myself. What are you doing out there? I was able to think of something besides the pain for once, which was really nice. It was, it was the first time I'd cut loose and since before I got hurt, and I forgot how good it felt to be able to do that again. And honestly, I don't think I'd been able to do it if I were coming here.
Out of the 7 days a week, I would probably have 2 good days.
How much medication percentage-wise do you think you've decreased versus what you're taking, say, even 4 or 5 months ago?
I probably went down to 80%.
Wow. What would you want to tell people about what we do? If there's one thing that we do to help people?
I would say you gotta try it, because I've tried everything. I've tried natural medicine, I've tried acupuncture, I've been searching for it. I've been all over the place.
Maybe better, felt different. Every time I wake up in the morning, I'm not stiff. I go home and I do my regular daily walkings. I do a little exercise with my kids. I'm able to do that now without even cramping up. So yeah, I wake up in the mornings, I feel rejuvenated. I feel like I'm 34 years old again. Right. Now, why I recommend you guys to come, because now the things that I do is when because I'm sick or so, it's like I need to get my fix, and I gotta get snapped, crackling, popping.
Do you guys get the same results? And let me know if that's too loud. I do not want to wake the baby. Please, do not want to do that. Does it get the same results? Do you document that? Does that help you not have to talk as much and re-explain everything over and over again? By having these results, I put them on video. I'm a YouTube person, Instagram, tic-tac-toe, all those ones for 1, 2, something. If it's appropriate, Facegram, all that stuff too. When you have that, they go, how does chiropractic work? Here, watch the video. What do you do for headaches? Here, watch the video. So it's not just me saying it all the time. It's when someone else says it for you, does that give you more credibility than just you doing it all the time? So, and I still, again, initial exam, boom, let's talk about your problems, talk about what's going on, communicate well for 1, 2, figure out what's going on with you. And when you do initial exam, how much do you talk? How much does the patient talk? What's a good ratio? If the patient's talkative. Some patients don't want to say anything, so you have to sign language of, hey, tell me what's going on. But if someone's talking, a patient's talking, should it be 80-20? 80% of the patients telling you what's going on and 20% of you listening? How many of us have gone to a doctor or somewhere where you're getting consultation and the doctor or someone you're talking to, for example, I saw my financial advice a couple of days ago, real nice guy. I went there for one little thing and he spent half an hour talking about his life. I'm like, I don't want to know. That's all my stuff done. Are my stocks going to make money or not? So I want to know. But something when you can listen more than you can actually, when you talk, even though the same things of what you may experience, you may be able to get some insight, let them talk. Let them spill everything they want to spill on you for the first 5 minutes. Then go, okay, I hear you did this. Hear you did this. This is how we help that. So when you repeat that back to them, this is how we help you, and you nod your head a little bit, what does that do? Confirms that you listened and confirms now you're going to help them. But you start going on different tangents, it's like, patient goes like, great, same type of doctor as my medical doctor. So can we be different and be a good listener to start before we do the adjustment? Then we get these results, so they want to tell the next person to make your life easy. Does that make sense? Just being, when I talk about communication, almost ironically, it's about sometimes not communicating, just listening is a good way to communicate. Anytime you get into a room and a patient goes, man, I was skateboarding, I was doing this, and you're a professional skateboarder, you're like, don't say anything, just let them talk. When you do that, it allows them to really understand that even though they may not say it directly, you're listening to their problem. Again, you want them to ramble forever. Who in your office, do you guys have a 5-minute rule? Dr. Rose, remember that 5-minute rule? You guys don't have that? If I'm in a room more than 5 minutes with a patient, I'm done talking. This is considered like a revisit, right? Another visit, you see them all the time, once a week, once a month, whatever it is too. 5 minutes, my staff knows, come and get me, I'm done talking, I gotta see the next person. So they don't feel like they can I want to say not abuse your time, but you're just there for them the whole day. So having that rule allows you to that window. The patient knows over time. The patient will know over a second, third visit, I have 5 minutes of doctor, and you got to get out of here. I don't want to waste this time. We all have things else we could do, right? When you're with a patient too for the first time, if they sit with your legs crossed, what do you do? Remember that saying? It's probably an old one. Like attracts like. If they talk in a low voice, what do? You talk in a low voice. If they talk at a fast pace, you talk as a fast pace. If they cross their legs, if they put their arms over their shoulder, whatever it is, you do the same thing. If they call the pain that goes down the back from their back to down to their left leg, sciatica, what do you do the first time you repeat that? Sciatica. And or they say, I have a bubble in the back of my neck. Yeah, that's what we treat the bubble in the back of your neck. So find certain words that they use that you'll kind of pick up over time, that's specific for how they describe something. When you say the same thing, you're on the same page with the patient. But don't go crazy and try to dress like the same patient every time, okay? Don't seem like he's wearing a blue shirt, I'm going to change my shirt. No. But be very conscious of what their mannerisms are to let them know, hey, unconsciously, I'm here for you. We're the same. I'm going to listen to you. What does that do when you do those type of things? It builds trust. You have less than 5 minutes to build trust with a patient. Why are they coming to you? Because their medical doctor isn't helping them. Because the medication isn't helping them. Their PA is not helping them. Their PT's maybe not helping them too. You're their sometimes last resort. So once you get that difference, that you're not like those other health practitioners, then you have a chance to really help them and see their overall benefit. All right? Any questions at all? How do you guys communicate normally? What do you guys normally do? What's the way you do that? More through verbal, more through videos? What's a good way for you that you guys communicate? Dr. Williams?
How do I communicate with a patient?
Mm-hmm.
Well, I generally will start off with a report.
Mm-hmm.
I want to find out what they do for work.
Exactly.
You know, and if it's something I've never heard of or whatever, I'll say, oh, really? Well, can you tell me? Because I want to know what their lifestyle is. So if they're a plumber, I say, well, do you climb, do you go up under the floor, do you do this or that? So I kind of get that. And then what I do is I explain to them. I say, have you ever been to a chiropractor before? They say no. I said, well, I tell you what, I'm going to explain all that to you, but I want to do an exam that's going to be your body telling me what's wrong with you.
Perfect.
I said, however, if you have a pain, I want you to tell me, and then I turn around and have them touch me there.
Perfect.
So that way they'll know that I know. And then they said, well, when they did that, I said, no. I said, I want you to be a baby. Tell me.
Yeah.
This is
Keep it simple.
to really cry out. And then once I do that, then I said, okay, you know what I like to do now is I like to have you lay down. I said, I like to do some therapy on you. We want to deal with the pain, deal with the tightness, and then I'm going to adjust you. But before I do the adjustment, I'm going to explain that to you.
Good.
Funniest case I ever had, I had a lady, I went through all that, and I said, trust me, I explained what I was going to do to her neck. She said, well, the last time I had a man trust me, I got pregnant. Right?
Yeah.
I said, well, I hope you don't get pregnant off this adjustment. Okay?
Wait a second.
But it's funny, when you say that, how they...
Like, wait a second.
That threw me for a loop when she said...
Like, hold on. Hold on. Let's back up here, right? Yes. Thanks,
biggest
Dr.
thing, especially the last several years,
Okay.
is reflecting mirror the mind therapy to the patient, because no one's listening to these patients in the MD's office. When you can restate what they're saying to you, they know you're listening. That took me a lot of years to learn, but it's essential that you do that more than ever now. I got people waiting 3-4 months to get in for simple stuff with their family practice.
Yeah.
And they come to me and I'm listening and they say, you're the first guy I actually sat down next to me and listened when you're turning away, writing that stupid little stand of their computer, and they're not even looking at you.
It's amazing how just eye contact touch. That gets their perspective. This doctor's different. He's asking the right questions. He's like I said, reinstating what I'm saying. At that point, I know he understands what I'm doing. I can trust him better. Dr. Williams? Yep.
I was gonna say, I don't think they make them anymore, but I picked up at Parker years ago. It's called a spinulator, and you hit the button, it shows all the nerves.
Mm-hmm.
And so when they tell me they have sciatica, I said, let me show you what we're talking about, and I'll go and cut it on, and I'll hit it so all the nerves flash, and then I'll go to that area, and they'll go, oh wow, yeah, that's it, just like that. That's exactly where it's at.
It's that
So
link.
I find that they love that, that visual.
Well, they see it, right? Again, how do we learn? We learn through vision, auditory, taste, smell, touch. So can you find out how they learn when you see them, like you just did right now, do this, they go, that's how they learn.
Yeah.
They get it. And you get it. At that point, you can help them communicate better than their last healthcare practitioner. Again, same thing. I had someone come in. I'd seen him for about 9 months. Hey, how's it been? It's like, I've been horrible. I've had this pain for a long time. I've seen 5 different doctors. No one can figure out what it is. He just retired, healthy guy. He looked like he had aged 10 years. After 9 months of not getting the right care, he says, his niece goes, my uncle is a radiologist in Texas. Let me send him your x-rays. You send the x-rays. Next day he calls, you have a double hernia. No one caught that. So the tech sent all the information to the doctors. Doctors just read the report, didn't actually go over the CT, the MRIs he had taken. So it took him 9 months to get the actual right care. Go ahead, good. Question? Comment?
No.
Good. A lot of it is can we do the right thing so the person knows that initial person, that special person, I call them special because they're in their office, they give you that chance to help them wherever they came from to get them to understand how you're going to help them. The spinalator, I had one of those in my office too. When we moved, we didn't put it up yet. It just gives that visual, and when you have that visual, people go, that makes sense. Once you get this, the head nod, you got him. Yes?
With that, in your interview, you're talking to your patient, you may be touching, maybe visually, eye contact.
Mm-hmm.
That patient is a kinesthetic, auditory, or visual learner. You can talk all you want. You can show them all the nice scan things. I went through all that with the videos and all that.
Yeah.
But I'm talking to a kinesthetic person or a auditory.
Mm-hmm.
So it's really interesting that you 100% you set yourself up for failure if you're talking to one of those 3.
It's almost if you have a script, right? And you just go through the script without feedback from the patient's reaction, you're just wasting your time. You're wasting your breath.
Waste a lot of years.
Yes. People go, thanks, Doc. I'll see you next time. I'm never coming back. Right? Yes, Doc.
Also, I think the doctor ought to believe in chiropractic.
Yes.
That's amazing.
Yes.
Now, doctors now, they just decide, hey, I'm here, give me the money and get out of here. And patients pick that up. If you don't believe in what you're doing and, and what you're preaching and what you're teaching, I mean, they see right through it. So I think that's why some people don't get their healing, because they figure, hey, this guy don't really care about me.
People don't want to be sold to, right? They can smell that a mile away. Yes.
A big thing to lose a patient, we want that rapport, is, okay, here's massage. Okay, the tech comes in the room, puts it on electrical stim, and then you walk in, adjust, and you're gone. I'm against that, personally. If it works for you, great. If you want money, great. But if you don't have that one-on-one doctor thing.
Where does that patient start the care? And my office, I don't do massage anymore. We used to. I don't do muscle stim, nothing. We don't even sell pillars or vitamins. We're just a real simple office. We adjust, we treat, give exercise, we're done. But the initial exam, when it's done by the chiropractor, then go, I'm going to help you, but I also want you to do this, this, and this after I treat you. When that communication doesn't happen, boom, you've lost them. Yes?
Yeah, my appointments are about an hour long. I'm
Fantastic.
with them the whole time. And I would say 50 to 60% of my patients, just the conversation makes them feel
Perfect.
Yeah, like you don't even have to touch them. But that being said,
Yeah.
I have had others that are like, oh, my knee this, my knee that, the doctor says this, the doctor says that, meaning primary care or
Sure.
ortho. And I'm like, well, did they ever touch you?
Yeah.
And they're like, no. Like,
Yeah.
okay,
Send me out for the
well,
x-ray, the MRI.
Yeah,
Oh,
so
boom.
I think that's a really powerful part of what we do, is just that we actually get hands-on time with them, and whether physiologically or like psychosomatically that's making them feel better, it's a totally different ballgame.
An example of when you're talking to them to make them feel better, what's a good example? Or a common example for you?
I generally have a lot of patients who will say, I know it's in my head at this point, and I'm like, no.
No.
Like, probably not. If it's chronic, you know, and I'll walk them through like what pain looks like, what psychosomatic pain looks like, things
Fantastic.
like that. But I'm like, it does, even if it is in your head, who cares? You feel it, right? Like, there's placebo and there's non-placebo, and it doesn't really matter as long as subjectively you are feeling pain. It's our responsibility to help you get to not feeling that pain anymore.
How did they get there? Because I've had the same example too, to where they've been told it's in their head. Why is that?
Mainly, and not to downgrade any specific profession, obviously, because I think we all have our spaces, but like if a neurologist or an orthopedic surgeon is kind of like, I've done the surgery, I don't know why you still have pain. I had a patient
I should have fixed you.
Yeah, she had a 3 millimeter disc bulge in like L4-5, like not something that normally would be something that we have to go in and fix, but the surgeon went in and tried to fix it, then she got a nerve ablation, then she got an epidural because she still is having pain. And I'm like, maybe the 3 or 4 millimeter bulge was a like incidental finding. Maybe you have something else going on. So
it's almost sometimes you're told to your patients, right? Same thing, where you're told, the doctor said, I can't help you with anything else. It must be in your head. I had a patient, same thing 2 years ago. She started with headaches, 19 years old, and then by 21, 22, the doctor said, we can help you. I'm seeing a psychologist. The psychologist said, well, after 2 visits, there's nothing wrong with you.
Well, the other thing I tell my patients, and I'm young, obviously, in this profession, so I may be wrong in saying this, but I really tell them, and I hit it hard on the first visit, that doctors can be wrong. I am blind in my right eye, have been my whole life, and I've been to several different surgeons who have said that they can fix it. One of those surgeries left me face down for 10 days, which is a very common thing if you guys haven't.
Got it, okay.
Yeah, and I got nowhere with it. So I'm like, you took 10 days of my life, where my life was hell, my parents' life was hell, wasn't fun, and I didn't get any better. So seek second opinions when you're being told something that you don't trust.
Especially when it's risky like that, where you're having surgery, where almost want to tell a doctor, what's the worst case scenario if this doesn't go right?
And encouraging them that I might not be the right fit for them. There are thousands of chiropractors in Southern California. If you don't have the time to be sitting here for an hour, there are plenty of other people I can send you to. And we don't take personal offense to that, obviously.
No, it's almost like you find your specialty, boom, you stick with it. If you're outside my specialty, here's a great doctor down the street.
Yeah, I've already spoken with other people today who I'm like, I have patients I need to send to you.
Perfect.
You are a better fit for that.
Perfect. Is that what we're supposed to do? Is help our patients no matter what? Yeah. For us or somebody else, right? We think we can help everybody. All right, whatever, you know. But something when we have that perspective, I think you get the idea of what are we doing right for people, and are we giving someone the same advice we would give a loving family member? I have some family I don't even like at all. I hate them. But the ones I do like, I'd want to go, okay, I want them taken care of, me or somebody else. So I might go same thing. I go, man, this is really bad. Let's get the MRI first, do an ortho consult, and then let's find if we can help you. But if you want to jump on everybody every time with the adjustment without understanding what their problem is, can we make things worse? Yes. How many times have you seen a patient from a doctor who's had back surgery, who's had neck surgery, and it's gone wrong? A lot of people get that. And what does the doctor say? I'm sorry it didn't go well for you. Good luck. And you're stuck with your quality of life for a long, long time having problems. We make sure that initial visit and whatever you do for your patients gives that the perspective for you also as a doctor, they're in the right place. We make sure that's the priority. Some comes in like, man, I have this really bad pain in my side. I had a fever for about 3 or 4 days now. It's hard for me to urinate. What should I do? Here's the ER. Here's the urgent care. Go right away. Maybe you two have something else going on for one too. Let's make sure they're in the right place for their condition right then. All right, so this is really, I think, helpful for all of us to share experiences. Right? I've been practicing for 23 years, 2 years as an associate, and I've had 2 good mentors, and even more than that too. when we share experiences and pay it forward to the next generation of chiropractors, even healthcare practitioners, anyone, allows them to have that doctor-patient relationship that we want for ourselves, right? How many times you've gone to a doctor, so we talked about before, you've waited an hour to see a doctor comes in for 5 minutes, talked about earlier, and all of a sudden we leave, we're like, that was a waste of time. Same thing with your patients too, same thing. You go, my patients come in and go, doctor told me this. I go, well, that's not right. They go, go ahead and ask for your copay back. You know, see if that's gonna work for you. So, quick one here. This is what I do every day. Quick adjustment. Coming back from UPS, I see a lot of UPS employees. They get beat up over there sometimes. Simple stuff. Guys do it every day. Simple.
Put the microphone close enough to the spine.
Yeah. I just do this one here. Simple stuff. Yeah, good fun. Easy stuff. You beat up over there. Hey, when you adjust them for the first time, what are the 3 common reactions that you see? Wow. Mm-hmm. Emotional, like, what the heck was that? I usually tell my patients, you might laugh, you might cry, you might speak in tongues, you might have Tourette's. You don't know. I go, but it's all normal, right? I want to make sure my patients feel comfortable with the first adjustment. If they're anxious, what's going to happen? Are they going to tighten up? Yes. Get them to relax as much as possible. Sometimes the patient is like I said, chronic pain, anxious, sometimes just overstressed. I go, stay in the room for 5 minutes. I'll come back in 5 minutes. Breathing exercise. Here's a heating pad, ice pack, whatever it is, just to get them to calm down, right? Yes?
Sometimes I won't even adjust them on that. I'll put them into motion
Mm-hmm.
and let them know, okay, you're so tight.
The setup.
But we're going to do this. Then when they come back the next time, then I go through the motion real slow. I explain it. Then I adjust them. And they go, oh.
You got to get them.
Have to adjust all the time.
You got to get them just to relax. Sometimes, like we said earlier too, you just be able to relax is what they all want. They want to leave feeling better, right? This is the goal. Leave feeling better. Maybe the adjustment, maybe a therapy, maybe something light for them too, maybe a stretch, so they feel better. And at the end, you'll see what at my door when they walk out. They read this every time just to get the idea of what we do in their office. So, can we make sure we're doing the right things to make them feel comfortable so that adjustment becomes normal for them? That adjustment comes, they come back a week later, a week, whatever it is for you recommend for your patients, for that, if that's what they require, to feel better. And again, feel better is not just physical, right? It's also psychological. So I want to make sure when they come back to me, they may have severe back pain for 3 or 4 or 5 months, or headaches or neck pain. I go, that's fine, that's your priority. My priority is get you to sleep better. Why is that important for them to sleep better? Earlier we talked about calming the nervous system down. Could go from fight or flight to a more relaxed state. Can I get you there first, then your body can start to heal. When you can communicate that and get them to do the same thing, they go, that makes sense. Before they leave, I'll walk out when they're checking out and go, what's your homework? Let me know when you sleep better, how things feel. So I want them to repeat that so they see the big benefit of not just the back pain relief, the neck pain relief, the headache relief, the sciatica relief. It's almost your body to relax to better state of health. How many times you've been just a patient, and you feel like, how do you know that you got it? That you got them to feel better right away? What do you do? I'm stand up and go, I ask them, I just literally ask them, how do you feel now? Does it feel different? What I do initially, I'll go over this toward the end too, I do a wall posture check first. I check where the pain is, and before I treat them, and then I go, after the adjustment, I go, let's do the same thing and see how that feels now. And when you get it, and they get that initial relief automatic from one adjustment, how do you respond? I say, for one, the adjustment relieves the nerve pressure, relaxes the muscle spontaneously, automatically. I said this is not massage, physical therapy, stretching. This is chiropractic. That's why I get the immediate relief when it's a nerve issue, a nervous system issue. So my job is to make sure they get that. So when they're in their state of euphoria, wow, what is this thing? They get to hear and feel exactly what the adjustment actually is doing to them. Yes?
What I learned from a chiro about 40 years ago was when a patient asks you, well, what's going to happen? Well, what do I expect? I say, well, today we just started your healing process. 1, you're going to feel better. 2, you're going to feel worse. 3, you're going to feel maybe nothing. And they walk out with that, and it makes them feel better. Now, some people say, why'd you throw the negative in there? You're going to feel worse.
No.
Because that's reality.
Yeah.
You can do that all you want and deny that, but those are the 3 things that can happen.
Why do you want to give them all that information? Because for me, it's going to be moves anxiety, right? Now they know what to expect, all three options, versus I don't know what's going to happen. If you don't know what it is, and that what's going to cause more anxiety. Yes.
What I like to do is explain to a patient, say, when you have an injury, you automatically swell, you get inflammation. With that inflammation, it pushes on the nerve endings, so it causes pain. And then what happens is your muscles will encapsulate it to protect it. I said, so our first thing that we need to do is we need to get the muscle spasm relaxed, and we need to get rid of the inflammation. Because that way, if we get rid of the inflammation, it won't push on the nerve endings, you won't get pain. So our first 2 or 3 treatments, that's our purpose. So we'll do therapy, and then when we do the adjustments, we want to set everything, and we'll keep that inflammation down. I said, that's why it's important for you to put ice on it at home so they get the concept of less inflammation, less pain, less muscle tightening. So I kind of take them through that whole series so they'll know that I'm not just adjusting them to get rid of it, but I'm trying to complete the whole cycle.
Look how nice and simple that was.
Easy, right? But when you practice it more and more and more over time in your whatever you want to tell your patients, it becomes normal, smooth, consistent, and builds confidence not only in them but also that you're telling them the right things, right? I remember going to a store a couple weeks ago. Guys telling me something like, I don't even know what your product is. You just sound confident. I'm going to buy one. When you sound confident, they're going to go, at least he understands what he's saying, can explain to me properly. At that point, that link system, my pain, I do this. At that point, it's going to get better down the line. When someone gets treated and they have chronic pain, for example, what's it take them time-wise on average to feel, I want to say, a better normal? Sometimes it'll take, what do most people say? 2 weeks, a week, 1 week, 3 weeks, a month? If someone's in chronic pain, it may take them 3 months to actually feel like their physiology has changed to a better state of normal. So same thing, giving them the 3 options of better, worse, or the same. When you give them a long-term framework of what they may feel, they go, this is not going to be a quick fix. I've had this long enough, it's not going to be a quick fix. So they're going to realize over time, it's going to be their habits, talking about icing, I do the same thing my patients do with neuropathy, and also homework, maybe stretching, some other things they can start doing, changing their habits so this adjustment stays. We know what stays means, right? The pain doesn't come back. But what's the number one cause of someone's, say, pain that's non-traumatic? Number one simple cause? Posture. Boom. Posture. And their posture has been gone or wrong, or not wrong, not ideal for a long period of time until they woke up one day, their back hurt, their neck hurt. They went to go brush their teeth, their back went out. So realize it's not the toothbrush, it's not getting out of bed, it's not your bed, it's not your pillow, it's your overall posture. So getting someone to understand what good posture is and how posture there may not be proper allows them to go, this is your long-term problem, we're going to help you fix long-term so your body can stay better. So a lot of us, as chiropractors, we're focused on the treatment, the adjustment, and what is the effect. We give them those options, it removes that anxiety. Ever adjust a patient and they have a funny reaction? Like I had a patient about a month ago, Jeff, hilarious guy. I just had intern room too, so she's my witness. I just this big burly guy, and he slaps me in the butt. Ever get that? Or was that just me? That's just me. I'm special. I'm like, it was funny. I adjusted him. And his back popped really loud. He's a big guy too. His back popped really loud, and he gets up. He goes, "Oh!" And he's like, psh. I'm like, "What the heck?" We're just like, "I don't know." He goes, "I gotta go. I gotta go home. I gotta go. I'll see you next time."
5-minute rule.
Yeah, that's like a 2-minute rule.
Slap you for 5 minutes.
I was like, "What the heck?" It's just when you're in practice long enough, I think you see and hear everything, right?
Yeah.
But again, when you can laugh about it, that point it keeps the seriousness down, even though you get the message across. And having fun with your patients, I think that's the key too. You know, I have patients they come once a week for the last 10 years. Marilyn and Robert. Sometimes Marilyn's sister comes too, and they come in and go, "Why do you keep coming in?" Good doc, you just have good jokes sometimes, you know, and like you entertain us, and they understand the adjustment too. It helps them also. But they sometimes people just need somewhere to go and vent what's going on in their life. They want to get treatment. They also want to make sure that they're doing the right things for their own health. And she has problems with eye pressure. I give you that. He has problems with his shoulders. He has shoulder surgery for one too. But having certain people that lets you know what you're doing right allows you to go, I'm helping people long term. Feel better physically, yes, but also emotionally too. I'm not charging them a $100 psychology fee or psychiatrist fee also. You know, could we just be sometimes a patient's, I tell my interns too, I try to be friendly, but not their friend. Does that make sense? Mm-hmm. I'm gonna call them Saturday, "Hey doc, want to go grab dinner?" I'm like, no, I'm not gonna, no, but I'll be friendly with you, but not their friend. I try to make every visit, if possible, personal and professional as much as you can. You know, and having fun with it too, I think is the key. That's why we want to do it for a long, long time.
But,
Yes.
I think everyone, like you say, you try to be, professional.
Yes.
Friendly, but not friendly.
Mm-hmm.
But everybody has a different style.
Exactly.
Okay, and like myself, like I'm a minister, and so a lot of time I get people that come from the church.
Yes.
So not only do they want chiropractic care, but they also, it's kind of like being in the barbershop. They'll tell me everything, and so I know how to deal with it.
Mm-hmm.
So I think everybody has a different style in how they treat their patients and how they relate to their patients. Because you get some patients, they need that.
Yeah.
They don't really,
That day.
yeah, they need
Yeah.
that.
Yeah.
You know what I mean?
Yeah.
I'm not saying you do it all the time, you be here 3 or 4 hours, but I think it's, because I remember when I first started, it was like, no, you go in, you adjust, and that's it.
Boom, boom, boom.
And sometimes those people, they really need that time to express themselves or to share with you what's going on in their life. So I think some people can do that. Now, I have a good friend, you might know him, Gene Olowski. This guy, he's like,
Boom.
boom, hey, okay, let's check that spine, let's do it. All right, you're doing good, all right, you're doing it, boom. He's doing that, but he knows how to do it where people feel comfortable.
Yeah.
I can't do that. So I think it's your style that you have to have, what you're comfortable and how your patients relate, because I always find you attract those type of patients that need that. So,
It's being genuine, I think, with your personality.
yes. Yeah.
When you have that ability to do that and communicate that with your patients, you'll attract someone again, like attracts like.
I would love to do that. I would just love to be able to say, hey, let me adjust you and get out, because they want to go in, and I don't know, they want to start confessing and everything.
5 Hail Marys for our fathers. You'll be fine. Absolution for you. Yeah. But like I said, that's what people like you, Dr. Rollins, because they like you and you're their chiropractor.
Yeah.
It's a combination of both.
Yeah.
If you don't have the like, there you go, hey, he's okay, but maybe Johnny down the street's better.
Yeah.
Because they're closer to me. They're open different hours. There's not that personal connection where they want to come and see you for their adjustment. Yes.
Some of the fine line, like you mentioned, seeing people from his church, that's
Yeah,
great and everything.
yeah.
Sometimes you got to draw the line with neighbors, certain groups you belong to. You don't want to be treating that person in that. You got to face the neighbor every day if they have a bad experience, or even a good experience, they bug you every 3 seconds. Every time you have to go move on, they're
Hey,
complaining about
I
the
got a
back,
little
you got
thing
back.
right here. What do
So
I do?
It's a fine line of deciding. What you want to
It's
call it.
almost like extending that line too up front. Hey, look, I'm going to see you in the office. Text me if you have any problems. But again, normal business hours.
Somebody boarding on your door, you know.
No, and for me too, just to be transparent, I always tell my patients, I always call them or text them the next day to see how they're doing. And that personal touch, this is classic just chiropractic or caring for people, allows them to go, hey, look, this doctor actually cares about what I do. He's in his off time, text me on a Saturday, how'd it go yesterday? Any questions at all? Did you get the email I'd sent you about your exercises? And when you do that often enough, they won't bother you. It's one of those oxymorons or something. I text all my patients, no one ever bothers me because they know I'm available. When they have to reach out to you and find you somewhere, it's almost like, okay, is that person really there for me? And I think that's the difference too. And I don't mean I'm treating my patients, my neighbor is falling on right now too. But they know, same thing, it's the respect value. And you'll get sometimes some different people, I call them, that want to call you all the time, talk to the time, and just drain your energy out. You got to have sometimes staff or someone put a firewall up for you. Okay, doctor's only available this time. If you want to come in, he can see you, but only has this window to see you. You're gonna have, and that doesn't happen very often. And sometimes it's different for guys and girls. Women, please be a little more cautious about it for one too. But a lot of it is, can we make sure we're available to our patients, maybe just for a quick conversation? You know, how's it going? Hey, thanks for the text. I'm doing pretty well. Have a good day. Boom, done. When you have that, then have that communication skills with the patients, communicate with them properly, allows them to see the benefit of seeing this chiropractor. Again, it's a personal thing, but also professional at the same time. So keeping it, if you want to call it, as good as you can for your personality. If you have kids, you have other stuff going on too. My kids are all done. I'm 22 and over now, so I have more availability. When you have small kids, do your thing, and protect your personal time. I think when we enjoy what we do long term, we want to make sure that our patients are taken care of, with us or somebody else. And our patients move out of the area, move back in the area, they come back to see me, my partner, whatever it is. That's when they get the benefit of knowing we're always going to be there for them. Yes?
I just want to share this on a personal note. When your patients know that you care for them, they'll care for you.
Yes.
Because when my wife was dying of terminal cancer, I had to do a lot of things. And all my patients said, look, Doc, you do that. You just let us know when you're available. But one time I had to go get some medicine. I couldn't find this medicine. I mean, I was looking everywhere. And my patients said, hold it, Doc. You know what? You go take care of your wife. You know, you're trying to do both, and you can't burn the candles at both ends. And so that was really nice because these are people I've taken care of over the years. So now they were taking care of me as I was going through my trauma, you know, through my personal.
There's what's that called? The universal law of equal exchange.
Yeah.
When you give stuff out, whatever it be, physical, monetary, whatever it is, it'll come back to you.
Yeah.
Not because you want to, because it's because
It was just there. I mean,
It's there.
They sensed it.
Yes.
They knew something. Doc,
Yes.
what's going on with you? And you know, I want to share. When I start sharing it, then that's when they to hold it. You know, I even had someone say, "Hey, I'll go pick up this for you. Hey, you know, I'll do this for you. Do you need anything? Don't worry about it." So when you do that, you know, it comes back.
they have that trust with you too. That when the patient tells you, "Yeah, thanks for asking how I'm doing. How are you doing?"
Yeah, they sense.
Yeah, they realize you're a human also. You have a normal life. You have family, kids, stressors, taxes to pay, whatever it might be. But when you have that ability to build that trust after the first adjustment, second, third, and fourth, and their communication skills allows you to now have people out there that know what you do. And again, since 2025, people still don't know what we do. So having that high, I want to call it, in my perspective, higher quality of care gives you the ability to help someone that may not have been helped before. All right. Another quick video. And these are my simple adjustments. They take sometimes less than a minute because they know what to do. They know how to relax. They just go for it. Again, another UPS employee. No. Simple stuff.
Bring that a little tight, buddy.
Simple things. A little stretch. Easy stuff. So treatments don't take very long for me because they know what to expect after the first one. The first one is where I do a lot of more talking, more like you had mentioned too, the step by step. And by doing that, by talking your patients through it, allows not only them to understand what's going on, but also protects you. Okay? I'm not sure who's coming in next after me, but how many people you know who know a chiropractor who's been sued before or brought in front of the state? Anyone? I know a couple. And the reason is, the reason is it wasn't communicated what's going on. They weren't told what was going to happen with the adjustment. They weren't very, very open to what was going on with the treatment, also what to expect. So when you give someone feel better, worse, or the same, you're giving someone expectation versus go home, I'll see you tomorrow. Wake up, now they have eye blurriness, now they have neck pain. So what do some people do? Some people do, they call their attorney. I'm in more pain after a chiropractor before attorney goes, great, let's start a case. Boom. That's some people's personality, whatever it is too. Can you avoid that for your own personal liability by communicating well with your patients the first day? You can do also is make sure in my new office, keep your door open. I do private rooms, but keep your door open slightly to make sure they can see whoever's in the hallway can see you also. So having that space where it's not completely private, it's not he said, she said. So it allows you to really understand, the patient understand, yeah, we're an open, I want to see you personally, but I want to make sure I can still hear outside. So it gives you that window of safety for yourself, for your own liability, not just the patient. Yes?
Something I always tell my interns is
Good.
You can't take an adjustment back. So
No.
every single time before I adjust somebody's neck, I say, do you want your neck adjusted? I don't care if and they'll say, Doc, like every time I say yes. And I'm like, yep, but maybe today you didn't.
Yeah.
And I'm covering my own ass by asking you every time. So my patients seem to like that. I'm like, go,
Yes.
First time you adjust somebody, it's okay to go a little light and then do a second adjustment if it didn't go. Because you can't take it back.
And when you communicate with patients normally like you do, where does it feel okay? Can I do it today? Anything different with you today too? They expect that same type of, if you want to call it, step process till the adjustment. So you can come in next time and go, and you forget to ask them, like, doctor forget to ask me, like, oh yeah, sorry. Because they expect to go, okay, what else is going on? How many times we have a patient come in, they run the door, as you're closing the door, you're locking the door, they go, oh, doc, I know I'm late, can I get adjusted real quick? One light, I can adjust, and they leave. So if you miss your steps, if you don't sometimes slow down, we can put ourselves in danger also. Giving that person a quick chance to relax. Anything going on? Actually, yeah, doc, I'm having some dizziness up here. My head feel a lot of vertigo, and half of my eye feels like it's blacked out. I'm like, that's not a good sign. That's a bad sign. Yes.
One thing I quit adjusting on, I do a lot of older people too.
Yeah.
And I just came from the hairdresser. Their hair was all
gosh.
done.
Yeah.
And she's been extended back, wash. I want to adjust them that day or a few days since because of VBI. Deep basal, and especially I've seen it in the emergency room too many times.
Yeah.
So it's okay not to adjust the neck that day. I don't care what kind of pain they're in. Just use the activator, maybe do some other stuff.
Stretching, whatever might pressure.
Don't touch the neck. I mean, it's words of advice. I've seen too many.
It's amazing where sometimes we forget to ask the person how their day
You're
was.
in a hurry. Oh, I just came from the hairdresser.
Yeah. Or how their day was, what's going on with their life, any injuries, any trauma, what have you been doing? They may think, yeah, I just saw the hairdresser for a couple hours or so. They may think it's not a big deal, but we know, okay, that's going to cause less stress on the carotid sinuses, on the vertebral arteries, so want to make sure you're going to be safe. They may not know it's a problem. Or they'll tell you, oh, I just had a fall. After the adjustment, they'll say, oh, I had a fall a couple days ago. That's why I probably had a headache. I forgot to tell you, doc. I'm like, great. Fantastic. Cervical fracture, great. Fantastic. Fantastic. Me document that one right away so I don't forget about that one. It's making sure we do our checklist so we're safe. Maybe a quick one, boom, 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 even after treating them also, so we know we're going to be safe. So protect, again, this is about the patient care, right? But about protecting yourself also. Because you have a next patient for the next couple of years, hopefully decades. That's my plan. So I also walk cocked and turning. They want to sit down with me and do a quick video explaining how the adjustment works. I go, okay, let's do this. So, quick one here. This is what I talk about my patients and also online.
This is Naomi. She's going to be my patient today. We're going to explain how the neck and the low back and the mid back.
This is like Dr. Williams, this is what I normally do.
How they work. By explaining our goal here is to make sure you feel comfortable when you come to the chiropractic office, what you should expect. Okay, the adjustments allows the bones to move. You may hear some popping, you may not hear some popping. By that movement, that popping releases pressure. You get the pressure out of your spine, then your body can relax, not only the muscles and joints, but also over time make you want to stay that way. So your person's health improves with chiropractic. That's your overall goal. So I'm going to adjust. I'm going to turn around for a second. Maybe turn on this side. I'm going to show you exactly where we're going to adjust here in the neck first, how to lie down in a second. Because I'm going to adjust these bones here at the base of the skull down to the shoulders here. Okay, that is your neck. You have 7 bones in your neck to go from actually 8 to the back of the skull all the way down to the top of the shoulders. We're going to adjust here, move things around left and right over time by doing a quick cavitation left and right. If you want to move better, you might hear some popping, you may hear some popping, but the goal is going to cause more motion. Things that can stretch and make that motion stay that way. All right, take it on your back for me. Go right here. I'm going to do is have her, I'm going to have Naomi turn your head to the right. By doing that, now exposes that left side of the neck. You're going to notice where it is. I'm going to use this part of my hand right here to cause that contact with the bones of the spine. Make sure your shoulders are relaxed. She's breathing normally. She's not tensing up on me. Now when I get in here, take a deep breath in. All the way out. Right here. Move that notice like that. Okay? We'll turn around to the side too. So make sure she's breathing normally, nice and relaxed. Shoulders relaxed, muscles not being under tension. Hold it right there. Take a deep breath in. All the way out. Right there. That allows the bones to move normally. A very quick motion, but a very limited motion so we're not going to rip the neck off. So muscles don't want to strain, but they just want to be stretched out. Okay?
Isn't that simple?
How about the ones that say, you didn't get this side? You got that
Go,
side,
shh.
you get this side.
Shh. You get that one out. It's amazing how they go. They always want the cavitation. And I understand, but I can go harder. This might be sore tomorrow. Might cause a stroke. I kind of joke with them. I can't break up the tumor. You have a tumor in your neck. But when you explain it properly, whatever you want to do, like a lot of people do here, and have a way to say it just off your tongue, that will make it so much easier for the patient to go, that's what it is. And that explanation, again, took less than 2 minutes. Someone that hasn't seen a chiropractor before, that has neck pain, they go, this is how chiropractic works. Does that give someone the confidence that they know they're in the right place? Does it? I think so. But when you can do that, allows that adjustment to be effective to get them the result short-term or long-term. Again, with other things you can do for them, maybe stretching exercise, whatever it might be, we'll go over some of that stuff. But that's the key. I think when we communicate our message well, the treatment seems very easy. There's another one too. We'll go that way. I'm gonna skip the mid back and low back ones. There we go. Here's a good one.
It's everything.
It's your dad's videotaping.
Deep breath in. All the way up. The head drops my hand. That's one reaction. That hurt me. That hurt me.
It's her dad's videotaping. He's like, what the heck? Yeah. Mm-hmm. Still gotta shoot videos. Still gotta treat people. So,
Good, one more breath in. Good Lord.
you don't know what they're gonna say, right?
Cracking?
Isn't it hilarious when you have a spouse in the room, and they're sitting there watching their spouse get adjusted, and what happens to the spouse that's watching them, the spectator? What do they normally do?
Ooh, I hurt
They go, or they go, they start laughing like, get my spouse, get him. Get him good. You know? So a lot, and when someone says, oh God, oh Jesus, what do you say? Besides laugh, I laugh. I say, no, just Dr. Tony. That's my response, just Dr. Tony. You know? You got to have I want to call it over time, just your reactions that go, that's normal. Keep the mood light as much as possible. Because if their mood's light, what happens? They're more relaxed. If someone laughs, does that make them feel better? Boom. Get them to laugh. Get them to enjoy it for one, too. At that point, just that alone will make them feel better. That's all they want. Simple. You know? Good. This is one, too, I show people a while ago. Beneath every treatment or procedure, there's a life who is loved by someone, person of dignity and worth, who is unique in the eyes of God. The task of every physician is to cure occasionally, relieve often, and to comfort always. This is was in my office before I even got there. I'm the 5th doctor in my office. Other ones all passed away. I tell my patients they didn't. Just retired. They just retired, but that's the thing is when you have that perspective, this is why I tell patients, before you leave today, your first visit, go read that for me. And if that's true for you, I'll see you next time. So can you make someone feel comfortable always, relieve symptoms sometimes, and cure occasionally, possibly, long term? But giving someone that perspective, take a picture if you want, you can copy it, paste it, sell it, I don't care, it doesn't matter to me. But can we make sure we're doing the right things for our patients so they feel that's happening every time? And make their adjustment, may it be 2 minutes, 3 minutes, a minute, 5 minutes, whatever it is for you, their treatment plan, at that point allows them to feel, I left better than I came in. It might be just a discussion, maybe just a talk. Hey, this is going on with me. I had someone come in, same thing, Robert, came in about a year ago, just didn't look right. I'm like, he's kind of pale, he can't breathe well. Told his wife, hey, ER today, now, let's go. So ER found a heart palpitation. And so when you see someone long enough and you see them often enough, you get that, what's it called, the red flag in your head? Oh, there's something going on here. Let's find out what's going on. And having that, listening to your intuition sometimes will save you a lot more problems for you and the patient down the line. Because some people have no idea what health emergencies are, especially guys, we're the worst. So we want to make sure we're helping them go, hey, look, this is what you do right now, not a question, go right now. I had someone a couple years ago, young kid, mechanic, he had hurt his back, helping lift an engine. Came in that day, had not gone to the bathroom for 3 days. What's that tell you? Problems, major problems. Took an x-ray, saw the L5 fracture, right to the ER. Had surgery that night. But if I had not seen him, what would happen? Maybe medications, maybe a long period of time, maybe other issues going on also. So having your ability to go, do this now, not a question, I'm not going to see you, allows them to go, man, that really helped. But just be cautious, be wary that they may see you, but may have a chiropractic problem. And just have in the back of your head, as I do every time I see someone. That's why I always ask, like you said earlier too, when you always ask, how's it going today, what's going on? It's not just what they say, it's almost how they say it too. I had my grandma when she was alive, I'd always call her on Tuesday, and I'd go, okay, Grandma, what's going on? And I always listen to her voice. Did she sound okay? She lived a little further away, about an hour away. So I said, if she didn't sound right, what would I say? I'd call her neighbor and go, hey, look, can you take her to the hospital? What's going on? Or just have that check-in to where you're listening to what they're saying, but how they say it is sometimes more important. We can have that I want to call it, what is it called? Just like a special tone where you hear, allows you to go, this person who I normally see in the right mind and also right attitude. If not, you go, okay, what else is going on? When you get that personal relationship, allows you to help them, like a lot of docs do already, outside of just their chiropractic needs. Yes, Dr. Williams.
Well, it's kind of like parents.
Mm-hmm.
Parents, mothers and fathers.
Yes.
A child can say, how you doing today? I'm doing fine.
Fine again.
And they know, okay, they sit down, baby, what's going on? But you sense it.
Yes.
You just sense it.
You kind of continue to ask them, what else is up? What else is going on?
Yeah. You just, you know, mother. I love mothers with children. You watch
Yes.
them, they can tell, oh, my baby's not well.
Yes.
Something's not right. Because they sense it.
We need to have that ability to do that, I think, more often, because sometimes you get to room. We have that building to do. Attorney's calling about this. We have this thing going on at home. The car's not working well. Someone else is calling you. You're like, how do I block all that out, focus on the person right in front of me? That's why I'm a private room guy, because it allows me to give me that space where I'm not seeing everything else around me. When you can block it out and go, I'm in my office, take care of my patients, boom, get ready to go. How do you guys prep yourself for your day? Do you guys listen to music? Do you work out? How do you get yourself ready physically and mentally to see people, say 9 to 5, whatever it might be?
A lot of prayer.
A lot of prayer, right? Please, God.
Metallica,
Yeah.
7 in the morning.
There you go. Yes.
Remind myself to always be present when I'm with a patient.
Good.
With them and not think about what else I have to do in the
Yes.
day, what my kids are going through, or anybody else.
I leave the phone in my drawer. Don't check it until I'm done with my shift. When you can do that, allows you to really go, you're with the person. Because the person will know when you're not with them. Go, Doc, you okay? I'm like, yeah, I'm good. My taxes are due when I'm about an hour from now. But I'm good. Yes.
A real good thing an ER doctor taught me, God, this is 40 years ago. Again, don't wear a wristwatch. You know what time you have to be at work, and you know what time you have to leave. Because it makes all the difference. And because I always wore a watch.
Yeah.
Quit doing that. It makes
Classic.
a big difference, man. Yeah.
Well, especially,
A lot of germs.
what's that?
Yeah.
I said when you're working with a patient, they have a lot of germs.
Yes.
Yeah, that too.
They're gross.
Well, especially,
What'd she say?
So there's germs when you're wearing your wristwatch.
yeah. Well, a lot of it, if you have a watch also that will tell you what's on your phone, like a message, whatever it is, it's annoying. You know, it's just annoying for the patient to go, you hear the beep, you're like, yep, got it, okay, respond. Same thing. It's almost like, just make sure they see that you're with them. Perspective is everything. You know, when we can do that, I think a lot of it is they'll know that, again, they can trust you with what's going on with their life, beyond just chiropractic care. Fun. Who wants to get adjusted? I'll go. You go first, and then Mom back there, then you after her.
Did I seem hesitant?
No, not at all. Move the camera over here. That's what I do. What I do too, I put this on you'll see my stuff at the very end. I have a YouTube channel. I have Facebook, Instagram also. I put it on YouTube down the line, probably today or tomorrow. Right here. All right, so again, Doc Tony, nice to meet you.
Stephen.
Nice to meet you. What's going on today, Stephen?
Just neck tightness.
More toward the skull or more toward the shoulder? Everything.
Yeah.
Does it go down the arm or down the shoulder, down the back?
No.
Perfect. Both sides?
No. Yeah, both sides. It'd be bilateral, but it's just a little bit of stiffness, no pain.
Perfect. Do you ever get adjusted seated?
It's hard for me to relax seated.
Okay,
So
good deal. Perfect. That makes my job easy.
supine
But
is better.
you know what to do. Come on down, all the way. And then scoot down more toward your feet. And then bend your knees so your legs are relaxed too, right there. Perfect. Where do you practice, Doc?
I don't.
Oh, good
I was
for you.
in Laguna Hills for a long time.
Oh, nice.
25 years.
Good. Take a deep breath in for me. All the way out. Right there.
Oh, God.
That's the plan.
Okay.
That's the plan.
I'm
Nope,
okay.
not
I'm
God,
okay.
Dr. Tony. Sorry. Deep breath. Deep breath in. All the way out. Right here. Shoulder relax for me. There we go. Piece of cake. How's that?
Great.
Mid back, low back.
Mid back.
Perfect. Scoot down toward your feet a little bit. Keep your legs bent all the way up.
Sitting in these chairs doesn't help.
And that's like all day. Cross your arms more toward your chin. Elbow to elbow. Boom, piece of cake. Take a deep breath in, Stephen. All the way out. Right there. All the way out. One more time. All the way out. Not bad at all. Lower one. Good. Low back too.
Yeah,
Do you?
go for
Good.
it.
On your side for me.
I just drove here from Phoenix.
From Phoenix? What the? So you moved
Towards
out to
you?
Phoenix? You moved
Yeah.
out there? Okay. The leg drop for me. The headrest doesn't really move. Let your leg actually drop toward me more, all the way to the floor.
Oh, okay.
Let it drop off because you have long legs like me. Allows you to relax back a little bit more too. Deep breath in for me, all the way out. There we go. Other side for me too. When you're adjusting someone, do you use a table for leverage? What I mean by that, if I'm here, see right there, I put my knee on the table so there's no back pressure. You guys do that? So much easier. If I'm here adjusting someone, I'm leaning over to use my back. I have to use my back so I don't maintain my balance. If my knee's on the table, now the table's holding my balance, now my back can relax.
I like how you're dropping because you're going to take all that pressure
Oh my
off
gosh.
that shoulder.
Yes. See, what I do too, I said a second over Steve, I do it automatically. I have him drop his leg down and bring your shoulder back more. Bring your shoulder back more. Bring your shoulder back, turn this way. There you go. That point, all I'm doing, I said earlier, all I'm doing here, stay right there for 1 second, hold that balance. I'm coming straight down on his back this way versus having to reach over his back and cause a shoulder issue. You know? So if you can get yourself set up where you're basically standing where you want to stand, weight on your knee on the table, at that point there's no pressure. You know, so you want to make sure, again, I've been practicing for 23 years, 2 years as an associate, then right here, the leg drop more. We'll see because back's a little tight too. What I'll do sometimes with my patients to make my job even easier, I'll drag their leg with mine toward me. So I'm just standing straight up, coming right here, take a deep breath in, all the way out, and coming straight down, and then release my leg. That's all I do. Is that okay?
Great. Yeah.
So the more you put yourself in a better position, you're not going to hurt yourself. Good? Not too much dizziness? I think when we worry about our own bodies and we take care of our bodies, we can last a long career. How many people you know are doctors, you know, chiropractors that have had injuries? Wrist, shoulder, back, you name it. Take care of your bodies. Do enough to make sure you stay flexible, stay strong, whatever you can do. You know, my biggest patient in my office was 460 pounds, 6'8". I'd be like a ninja. I was outside doing push-ups outside the room, so I'd hurt myself. You have to make sure you take care of your body. And for me, some people like to do the prone adjustment with the thoracic. I've long arms, so at that point I come right across the body and use their body weight to drop on them. Again, my body's here, my leg's here. I'm going straight down on them too. Mom, come on back. No. It just take care of your own body also, especially when you see 60, 70, 80 patients a day. Mom, what's going on? Tony, nice to meet you. Veronica, nice to meet you. So what's going on today? Good. This is called life, being a mom of a 9-month-old. Woo! How's your pregnancy?
Pregnancy was easy. Delivery was kind of not.
Okay.
Ended up having a C-section.
Yeah. Okay. Life, right? Plan A, B. What's the number one goal of having a baby? A healthy baby, right? 26. Yeah. Or 22. Yeah. But at that point, having a healthy baby, no matter how you get there.
Yeah.
So what's going on today?
Just everything's tight.
Good. And any headaches?
No.
Perfect. Let's go on your back for me. Hip pain, low back pain, even?
Yeah.
Good, perfect. So as you guys do probably already too, I always do a leg pain check also to make sure if someone's having one-sided low back pain, are their hips shifted left or right? And when I say shifted, I'll show them too. If someone's leg is, for example, longer on this side, on her left side, Veronica's left side, shorter on the right side, I'll tell them this, is here, Veronica, your leg is, so they can see it, dropped on this side and higher on your right side. So they see the shift in my back. Obviously, I'm exaggerating it to get that body, so they go, I have to bring that back to better position, better normal. All right? Something simple. Here too. Get that neck done first. Deep breath in. All the way out. Good. Deep breath in. All the way out. Very simple. When you're adjusting someone's neck lying down, does your elbow come out here or does it stay in toward your body? Here, right? If I come here too many times, shoulder. So coming inside, keeping that shoulder in as much as possible, moving your body more, allows you to take the pressure off your shoulder. Good job. Cross your arms. How's your baby so quiet? Did you
got lucky today?
did you drug her before you came in? No? Just want to make sure. Deep breath in. All the way out. Good. Deep breath in. All the way out. Good. And one more time. All the way out. Boom. Is that okay? Whew, that was the spot. On your side this way for me. Good, right there. The leg drop for me. Right here. Good. That leg relax. Bring that leg back a little bit more for balance. I want you to fall. It's only like 2 feet, but I don't want you to fall. Deep breath in. All the way. Good. Do you guys do a straight hand contact or you do more of a forearm contact? Both, right? I used to love to do this here. After 23 years, I'm going to go more here. If this doesn't work for me, then I'll go back to hand contact, do more sacral move, and just drop down that way. Good, other side for you. You youngsters, you guys can do whatever you want to do.
You got time to get part.
Yeah, you guys have a while. Here, Veronica. There you go. Good, deep breath in. On. Easy. Good. Coming up. Is that okay?
Yep.
Good. Enjoy the rest of the day. You're welcome. Yeah, I think that's the key is when you do it often enough, how do you adjust your body to protect your own body too? You know? And stretch and strengthen everything we do, take care of our own selves, not just our patients sometimes. Sometimes you forget about that. All right? I'll get you 1 second. Let's do one more thing here. Do you guys adjust kids? Yes. Good. I'm not a pediatric chiropractor, so I won't adjust them if they're like an infant. My rule of thumb, if not walking yet, I send them down the street. Dr. Jared's phenomenal. He's a pediatric chiropractic. He does that, or even pregnant moms sometimes do. So we have to figure out our specialty, right? And he does a phenomenal job with that. So I treat kids as much as they can. Simple stuff. They move like so easy. So easy.
Kids are great. Kids move so easy.
Yeah, see?
I just feel like it's still a little.
Yeah.
Good result.
This is when I used to wear a shirt and tie at the office. So remember lab coats too? Back in the day. I do. I remember. All right.
With your work, you hunch over a lot because you work.
Another people I'd met at a networking thing, they want to come in and basically do all the videos. This before COVID.
Deep breath in, all the way out. And again. All the way out.
Oh, little leg kick too. You guys get that? Leg kick. Fun. Got to watch it sometimes. Look at the back of the head. Easy stuff. I usually do cervical seated for the headaches, suboccipitals. Get them loosened up a little. Richard.
On your side.
Easy stuff. Easy. Boom, so quick. Boom, ninja. First time.
Okay. How'd that feel?
That one felt like I needed it.
Now it's your husband's turn. Again, you never know what's gonna happen. Well, hit both sides. You guys ever use that? The leg kick. Yeah.
Whenever you're ready.
Yeah. Oh, just don't want to get in their way. Little rib issue. Little rib. That's fun. It's fun, right? You gotta have fun in your practice. You know? Again, we treat all this stuff, right? Better sleep, we talked about headaches, stress, improved posture, pain relief, more energy. It's stuff that people may think one or two, but like, how does that affect stress? How does it affect my energy? So when we have a way to say it smoothly and rhythmically, at that point they go, oh, that's how that works. That's how my spine's connected to all these things. So they see you as the doctor to improve your quality of life, not just pain relief. So you keep your practice busy all the time. You ever get that to us? I go, reminded me, how do you distract your patients if they can't relax? What technique do you use?
Sometimes just talking to them. Again, if they're auditory, visual,
Yeah, exactly.
I'm touching them, I'll be, or talking. Or
Well, if I'm on their back too, what I'll do is have them bring their feet together. And when they touch feet together, then you got them. Tell them it works once. Or maybe cross your arms and just squeeze your hands together. Yeah, wiggle your toes. All it is. Like, it works once, and then I won't get you next time. Once you get the first one out of the way, they kind of relax more because now the anxiety is gone. I think that's going to help a lot of people, the first patient, first time, like he was, just to relax better. And he's just comedy sometimes, too, just his personality.
just don't say, how's your mother-in-law?
Yeah, exactly. Not again. No. 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 Are you ready? One more we'll see. Go a little bit closer here, too. There we go. Get out of the light. Just focus on you. All right. Doesn't matter. What's your name?
Myra.
Myra Tony. Nice to meet
How
you.
you going?
What's going on, Miss Myra?
Neck, I had surgery like over 25 years ago.
Okay.
So I don't have my sternocleidomastoid. So
Yes, okay.
my neck is
So there's more
you know,
pressure.
pressure, yeah, and mid back and low back. You know,
Perfect.
just like all chiropractors, we take care of everybody else.
Yes.
And sometimes we forget to take care of us.
And any neck surgery? So more the SCM, right? Okay.
Yeah.
So do you still get your neck adjusted?
Yes, but I don't have muscle over here.
Yeah.
So if you put pressure over here, I will start coughing.
That's not cough. And you ever get that to where people had surgery before and now their muscles have had to adapt to their position? I had someone who had actually brain surgery, so their whole problem for one too. So you almost have to go, okay, is it first, as you know, it's safe because you've been treated before, but also can we make sure that, okay, what else can we do to help them over time improve? So how do you like your neck adjusted? Lying down, seated? Perfect. Let's go right here. I'll do this side first. Okay. When I adjust someone seated, just so you guys see this, what I do is contact with my anywhere from these two fingers, even three sometimes, to the base of the skull, the very top, this is the occipital area. Then here, just for placement, bring your head back, Myra, just a little bit for me. Is that okay?
Yep.
Simple stuff, right? Easy. And I contact just the skull, not the neck itself, the very base, and just more of a lift,
Like an occipital lift.
occipital lift, and a little bit of a drop, just like that. Very simple. Sometimes if this side doesn't move very well, what I'll do, just stay there for 1 second, I'm not going to adjust you. I'll sit here, I'll hold the contact with my left hand for this side and do a straight lift here with my thenar, right? Or this thenar, right? These big words I forgot sometimes. Here, and do a quick lift up this way to get that to separate. Especially when it's really locked up. On your back for me too.
Face up.
Yep, face up.
Why'd they take away your SCM? What happened?
I had a lump or a tumor in my SCM.
Ah, okay. Cross arms. Well, good they removed it. Deep breath in. All the way out right here. Myra right there. All the way out. Ooh, you were tight right there. Good, one more breath. Bring your legs down for me. Other one. Good right there. And one more time here. All the way out. Right, on your side for me too. When you adjust someone, do you guys do that too? What I just did? When I adjust someone, so if you listen here, deep breath in. Let your actually leg drop for me. There we go, Myra, right there. Deep breath in. All the way out. And one more time. There we go. Good. So I say good every time as my reaction because I want them to know that I got what I wanted to get. Other side for me too. Again, it gives them confidence that I know what I'm doing. Good, right here, Myra. I'm going to a little more leg drop. There we go. Deep breath in, all the way out. Myra, good, perfect. All right.
Perfect.
Come on up.
Thank you.
You got your welcome.
Thank you.
Enjoy the rest of your day, Myra.
Thank you,
Have
thank
fun. Is it good to say someone's name when you're talking to them? Isn't that important to know their name and say that while you're talking to them? Yes, Dr. Rooms.
Always ask.
Always.
Always.
Why?
Because I was always brought up, you always respect your elders.
Yes.
So if I have someone who's older than I am, I ask them, I says, what can I call you? Miss Jones or Sally or whatever. And I said, well, you call me Sally. And they always say, thank you. I said, no. I said, these young whippersnappers now. Hey, Sally. How you doing?"
Whippersnappers.
And they're 25 years old and they're talking to my 80 years old like this, their buddy. So I always ask. I never assume.
And sometimes, especially with senior patients too, they just want the respect.
Yeah, I always do that.
It's going to their, I'm not even culture, just their way they grew up. And again, like attracts like, can you at least understand that, respect that, and then do your own thing. Sometimes people come in, by the time it's written down, I can't pronounce it properly. So go, tell me how you want me to say it. And is that the name you want me to use in the office? Sometimes they'll say the name is John, we want me called Eddie. I'm like, I don't know why. Doesn't matter to me.
Some people don't like their first name,
yeah.
their middle name.
Or their dad and grandfather call the same name, so call me what my family calls me. So you got to figure out what works for them.
The other day I called somebody, Deborah, come on back. Don't ever call me Deborah. My mom used to scream.
Ugh.
Her name is Debbie, or vice versa.
Okay.
So I learned
Like,
the hard way. This is like last week.
Note on chart,
Yeah.
highlight,
My
circle,
wife
and
wrote
put
that
some
really
stars
good.
on there. You ever, I made a mistake a couple times. It was weird, really weird. I'd call patients before, right? Hey, how's it going? Whatever it is too. For some reason, because I just talked to my wife afterwards, before I talked to this patient, I go, okay, Sally, have a good day, love you. I'm like, why did I say that? Yeah, I'm like, why did I say that? And then like two days in a row, I call the doctor up. I go, hey, what's going on? I have a doctor who may want to sell his practice. Interested? Hey, man, have a good day, love you. I'm like, why I keep saying that? Get out of my head. Weird.
I teach martial arts at night.
Yes.
So at nighttime.
Yeah.
So we say in Japanese, domo arigato, domo. The other day I went with the doctor on the phone, domo.
He's like, what the heck? Am I ordering sushi? What's going on here? Did I call the wrong place? What is going on? You almost like, it just comes off your tongue, right? Like boom, boom, boom. But it makes it entertaining though too. I never called the patient back. I'm not calling back. I'm not going to tell them what happened. But I love you, but not in a professional way. In a professional way. Not the other way. Yeah, exactly. We love everybody here. You're one of a lot of people loved. But again, having fun in your practice, having fun what you do, having fun with the adjustment, having fun with just being in your office too. If someone sees you as a chiropractor having fun, enjoying your practice, are they going to be able to trust you more? Yes. They want someone, again, that they want either like them or want to be like them because you're relaxed. You look healthy. You look like you're energized. Can you be the person, be their example for them to go, hey, look, this is what I want to get you to. They can, like I said, they can hear you all the time, but can they see your actions also? Realize that's more important, your actions, what you do versus what you say. That's huge with people. If you can be the example for them, what they do. I sometimes put videos up, I'm hiking, whatever it is, too, my social media stuff, my YouTube stuff. Allows them to see what you do to stay healthy. That helps them stay healthy also. All right. So one thing I want to show you guys, so what I do with my patients over here, I don't have a flat wall. Show you over here, is talk about initial patient exam, right? What I do here, also do with them is a wall posture check. Very, very simple. I'll use this wall over here, so everyone can see. I have them do before I adjust them, especially if they have one of their symptoms is non-traumatic back pain or neck pain, really the bad posture. I'll go, okay, put your heels against the wall, hips, shoulder, and head. Drop your hands to your sides, hands open. Does that feel comfortable for you? What will most patients say with bad posture? What would they say? They feel like they're almost leaning, feel like they're leaning back too far. Because the center of gravity is here, right? At that point, when you go back, more than you go, I feel like I'm leaning back too far. I feel like I'm off balance. Yes, my whole body feels like if they have back pain here, they go, my back feels like it's tightening up on me. If they have neck pain, like I feel like my neck can't go back too far. I feel like my shoulders can't open up this way. It doesn't feel comfortable. What I do is once I adjust them, I go, now stand against the wall again. How's that feel? 9 out of 10 times they go, this feels easier now. I can do this easier. Go, let's make that your normal. So reverse it and go, you have bad posture. The cause of your pain is bad posture. Your body, that is your default posture now. Let's correct that over time. Then your body can feel better and stay better. You don't have to see me, all right? Because if you don't like me, you just don't have to see me at all, all right? So what I have them do is, even for the homework too, go against the wall. At that point, stay there for 10, 15 seconds or so. Then walk on your heels, heel to toe, back here. Where now, I know it's going to feel uncomfortable right now, but over time, that'll be your comfort level as your normal default. So if they have bad posture, I'm going to relate that back to them and connect that wall posture check with them so they see the difference. When someone feels something physically, does that become more of a permanent record in their head, their mind, versus just telling them what's going on? So that they feel that difference, they go, wow, that is different. So when you can get someone to feel something different, physical and emotional, sets a good imprint on their memory. All right? Any questions about that? Again, real simple. Heels, hips, and what I'm doing too, especially during COVID too, I always point heels, hips, shoulders, and head against the wall so they see and feel that for 10, 15 seconds. And just relax. And what I do when I'm doing this with them, I don't say a word for 10 seconds. I don't want to distract them from what they're feeling. Give them a chance to really let it settle in, before and afterwards. So you're not distracting them with your words or whatever you're doing in the room. All right? And it's good sometimes when you're with a new patient especially, is to pause, right? What does a pause do when you talk to somebody?
Helps absorb.
Give them a chance to absorb it. Gets them a chance to re-listen to. When you pause talking to anybody, they go, did I miss something? Why are they pausing? And then you start talking again, they go, okay, I'm in again. So they want to realize by the pause, it gives them a chance for them to, one thing, reset, and for them to now hear something again that you may have told them before the pause, and now let it settle in their head. It's just communication. Sometimes we want to talk, and not let someone listen, actually getting and absorbing the information. That make sense? It's a huge way to communicate well without actually communicating. It's amazing. It's trickery I call it, magic. Just magic. Okay, watch. You may have seen this guy. He was in a recent LinkedIn video, a commercial, State Farm commercial last year. Have you guys seen the show? It's called Running Point on Netflix. He was in this show too. Real good guy, just a little comical sometimes. Every time with this guy. His wife's videotaped too.
Honey, really, this is gonna be okay. Remember, it's gonna make you feel better.
I'm gonna have you go, right?
He's funny.
Oh God, when the movie's so violent. That's a lot of pressure. Okay. That's really loud in your ear, probably. Yes.
I can tell he's not a small guy either too.
See, I can't do this stuff for you, honey.
Okay.
This is why we made
Beast.
the appointment.
That was a harder side.
And remember, breathe, relax.
Good.
Take a deep breath in, all the way out. Put your hands together so.
His first visit ever to a chiropractor.
Does that feel okay? Yeah, it's exciting, right? But it feels okay. Oh, what exciting. That's the hard part.
Gotta throw it out there.
All over, deep breath in. All the way out. Good right there. Oh, my God! Right here, deep breath in, all the way out.
No, maybe like the middle easier one. Not yet. Go back. Okay. Move on your shoulder and on your hip facing this way. On your side.
Ugh, so
This
traumatized.
is the part that you want me to do for you.
Right here. Bend your arm up. Right here.
Okay, hold up.
Right
A
here.
little stretch.
Right there. Real easy, right? Deep breath in. All the way up. The shoulder relax.
Oh, wait.
Right there.
Did anything pop?
Yep. Right there.
It did? Okay.
Easy. Easy stuff.
Other side.
He's like,
This is gonna be great when it's edited.
fatigue.
So great. Right, hi, honey. Relax.
This will be fun too.
Oh,
Breath in. All the way up. So maybe bring your hand back for me.
is that?
Yep. That's the one.
Is that the one that I can't get?
Okay.
Get the head back technique, right? That one distract a little bit. Head back. Guy's not a small guy either. He's a big guy. He doesn't fit through the door. Guy's huge. He's like as wide as the door.
So connected.
Okay. I'll start building that. Mid back and low back.
Feels that better in the back.
Really?
Lower back, yeah.
Not as good.
It was locked out before.
Yeah,
You can lift your knees. Lunge. Okay, that's good.
Oh, wow, man, look at that. Did you see
No,
that?
dude. Oh,
You
you
see
can
that?
practically put your palm
Look
down.
at this. You see that?
Oh, there you go. Look at that.
Oh,
I'm telling you.
sorry.
This is you feel something.
Creepy, I'm sorry. Okay.
Just normal reaction to your body. That's all it is. We suppression.
Thanks, doctor.
This is fun.
Is that it? And backstory too, actually have him and his wife. I adjusted her first. I adjusted her for first adjustment. He ran out of the room. He took off. I'm like, where's he going? He's deathly afraid. So what I say? Let's videotape him. She goes, yes, please. You know, you never know what's going to happen. But it's when you catch things like that, it's yes, entertaining, but also hopefully just it's more of he gets the relief, he comes back again too, and we all benefit, right? I think that's the key. Again, simple stuff we always see on people. We know actually. Look well to the spine for the cause of disease, right? We all know this. I have all these posters or pictures, whatever you call them, in my new office in each room, so they see it every time they walk in the door. So they know what to expect. They know a lot of it is what we do. Yes, is philosophy. Yes, is technique. Yes, is action for one. But a lot of it comes from the right philosophy. Been around for thousands of years. And when we understand that, we can respect that, I think, more because it's been around for so long. It's a truth, not just an idea. Right? Is there a difference? A truth versus an idea. So we work on truths, and we know how the body works. We're neurologists, and we can actually fix the nerves to make the body feel better and stay better. But communicate well. Yes, Dr. Williams. Yeah.
I want to come.
Of course.
I want to give Dr. Tony a plug. He doesn't know I was going to do
Oh,
this.
great. I have to pay him later. What about a blank check?
I went to England for about 6 weeks
Yeah.
to run a clinic over there in 2024. And when I walked in my office, the whole left side was flooded. I mean, just flooded. Fortunately, it didn't touch
His office here,
computers
yep.
or anything. So I came to a seminar, and he asked me to be on one of his videos.
Mm-hmm.
And so when I was telling him that was flooded, he called me and said, Doc, my office is open to you. You can come use my office with no problem. He says,
Easy.
I just want to let you know that I'm here for you if you need
course.
anything. Now, I hadn't known him that long. I just met him at the seminar.
Couple weeks ago.
And so I just wanted to let him know that in contrast, I have a doctor in my area. His last name is Williams. And his patients actually come to my office, and I'll send them to his office. They'll call my office because I have a website. I'll send him. He's never once called me and said thank you. And I've been doing this for about 7 years. He's never once called and said, hey, Dr. Williams, thank you. I've had people actually fill in the paperwork out in my office, And they said, well, you know, my wife, and I know all my patients. I said, no, you need to go to the other doctor because I don't take other people's patients.
Yeah.
You know, but he's never once called me, but yet
Of course.
he reached out. So I just want to say thank you.
Of course, brother.
Okay.
Nah. And doctors like this too, I pick their brains because they've been around for a little bit longer than me, just a little bit longer than me. And he has the heart of the best chiropractor I know. He's great. You know, when you can help our colleagues out, I think that makes your profession grow more. We're all going to go through tough times. That's just life, right? But helping each other out really should be for anybody. It doesn't have to be a chiropractor, it can be anybody. When we pay it forward like that, it should make us feel better, not just them. I did it for selfish reasons. I wanted to help myself feel better. I'm kidding. And a lot of it too, that Dr. Williams, sometimes I tell people it's the person, not the profession. So when someone comes to your office and goes, man, I went to chiropractic a year ago, hurt my back, I never felt better afterwards, but my friend says, you're a good chiropractor, can I come and see you? Yes, and I tell them, I don't want to badmouth anyone. I tell them, it's the person, not the profession. When they tried to call him, the doctor never called them back. They said, well, here's my information. It's still the person. So we can go, yeah, they may not have worked for you, because what are we? We're really artists, right? We have our own art that we do for our patients, communicate how our skills are, everything we want to do. So knowing that your art may be different than mine, it's not good or bad, it's just different. If we can match up my skills with what you need, fantastic. If not, here's a number. For me, Dr. Jared does because he does pediatrics. You know, he does other things that I don't do. There's enough people, as we already know, abundant that have back pain and neck pain. We're like the mafia. You're always going to have to use us. We're always going to want to come back. And there's enough people out there. So we make sure we're spreading the word more of what else they can do to help themselves feel better, I think. That's the key. And we did a great podcast together, too, about, was it Dr. Goodhart?
Yeah, Dr. Thee.
Dr. Thee.
That's why I got trained.
Yeah, Dr. Thee. Dr. Perry. It's almost like when you have someone with that type of experience, Dr. Williams, for me, I pick his brain and go, hey, what else can I do? He knows his stuff. You know, I have interns come to my office now. They come and volunteer for maybe 3-4 hours a week. I have students from Cal Poly, because I live near Ontario Airport. They come and volunteer. They want to see what I do also. I want to teach them next step. They may not be chiropractors yet, but just to be a good healthcare practitioner. You don't have to be a chiropractor. You can be anything. I have a podcast. You'll see in a second too. I interview a lot of anyone in healthcare. Functional medicine doctors or practitioners that are nurses, that are other even chiropractors too. If you have good communication skills, can help someone short-term, long-term, it doesn't matter what field you're in. Just be, like you said before too, have the heart in your field. My wife asked me a couple months ago, what's your favorite day of the week? I said Monday. So I go back to work. I love seeing my patients. And I love being there with them. Or someone coming in an emergency, hey, what's going on? Helps me continue my skills.
I thought you was going to say because I don't have to be here with you.
Well, no. That'd be another night on the couch. I don't want, the couch is comfortable, Dr. Williams, but I don't want to be there every night.
And the garage is even better.
Depends how warm it is outside, right?
You got a dog, so the
Yeah,
dog will be
exactly, yeah.
in the doghouse, right?
That's okay. Been there, done that. Life, right? but I'll use that next time. I'll use it next time she asks me. You know?
Dr. Williams told me to say this, right?
Yeah, exactly. Yeah. She's like, if I was like, I'm gonna stab you one night, and you know no real reason why. I'm like, yeah, you could probably stab me now, and I know there's a bunch of reasons why. You know, that's good one. Good one.
A few times.
Yes, you know, it happens. It happens. Another one too. We talked about earlier patient reactions, and sometimes again we get funny ones that are just you can't stop recording them. This is probably her. This is every time she comes in. Not just the first time, every time she comes in. Every time. Just a cackle, not even a laugh, a cackle. Try the videos. This is like 2015 or something like that. Not the highest quality. Every time. My staff knows Claudia's here. I'm like, okay, give me a few minutes. Every time. Good times, good times. All right. This is my office before I actually was there too, same thing. Even if it isn't the best day of your life, why not pretend? Yes.
Well, I just wanted to show you where you were sharing this. I had this one lady used to come in,
Yep.
and every time she would come in, she always came in when my office was packed. I mean, just, you know,
Good
people
timing.
standing around, and she
Good
walked
timing.
in, and when I would adjust her, she would go, oh, ah, oh. And I'd be so embarrassed, right? Because the door would be closed, and she would think, oh. And when she come out, then she would look at everybody and say, oh, he makes me just feel so good. And I'm standing there, right? I'm like, oh, God, I hope these people don't think I'm, doing something. And then the next lady come in, she said, well, I want what she got. And she would do this every time she would come in. But she would I don't know how it was scheduled. She would always come in when it was just packed. Okay? And people would be looking at me when I was coming out, and I'd be
That's called an open door policy, Doc.
Yeah.
Open door policy. Gosh. When you give a person a perspective like this, it gives them, a reason to feel gratitude for just being alive that day. So when you change your mindset, when they walk the room, like they have all these problems, I understand, but give them the chance to change their perspective, at that point they go, okay, now I want to get myself better. A lot of it we do, as we know, is mindset. We want someone to feel better and get better. When we help them change their mindset, allows them to really see the benefit of what we do. Again, we all have this in our office, right? The spine. Again, a visual so people see what we do. This is my new office. We do digital x-rays there too, little models for one. This is, again, new patient exam. They want to see things, feel things. What is this? This is a disc. This is a bone. This is the facets. Transverse process. So they can, if they're kinesthetic, I think it's called, they can actually feel what's going on to get them to realize the benefit of what we do. And I tell patients, when I take x-rays, take a picture of your x-rays. Take your own pictures. This is your body. Take care of it. Another one here too. I think last one. Again, sometimes we have, again, dramatic patients. They're in pain, but we get them out of pain. Every time he comes in. And the same thing, Doctor, like, put him in the back room so people can't hear him. Head back technique. Distract. You know? This is sweating. It's like.
Oh, man.
Every time.
Same side? Yeah. It's like a. Is this normal? Yeah. Simple part to get better. Does that feel good?
Breathe.
I feel relieved. Yeah. I feel, I think I'm still gonna. It's gonna be muscle spasm, but not the joint lock. When the nerve calms down, the muscle relaxes. Now the muscle's time to heal. So we pick this one up. I'm good. I'll pick it. That's the stable side. Your left side. Is focus on some stretching. It feels good. Yeah. Keep your body super more mornings. You control all 100%. You had this one below your hips while you had that sharp pain. Now it's calming down. Now we kind of get to where the spine does unlock completely, so you get that better side. Yeah. So it just happens to take care of it right. Yesterday was bad. Yeah. So I felt I was able to sleep today a little better.
And sometimes you get patients that are a little more dramatic than others. We all have them, right? And his wife, because he's special, Jack's great, he's special, his wife has my number. I go, and Jack, because she'll text me, Jack wants to go to the ER again because his back hurts. I'm like, I'll see him tomorrow. Perfect. So she'll talk him out of it because he has he wants to go to the ER for everything. And just, I'll see him tomorrow. Got it. Done. He's already scheduled. He's in. So having that connection with your patients, what their mindset is, he may seem like he has to go to the ER in his mannerisms, but it's because it's who he is. They're saying that at that point, get them to avoid the ER visit for one, and see you instead. I had a patient a couple years ago, again, UPS employee. He came in on Monday, and he left all upset. I go, John, why are you upset? He goes, I went to ER yesterday, spent 3 hours there. They gave me a bunch of meds, didn't help. I came here for 10 minutes, and I feel 100% better. I'm like, what you do next time? Never go to the ER. No, but maybe call me next time. At that point, you avoid the stress of that. This is my podcast. As Dr. Boom's on my podcast, where if you want to be my podcast, let me know. I interview doctors all the time. That's what I do. And that's my information. All right? Any questions at all? Questions, comments, concerns? Do you have your patients do exercises, exercise guidance? How often should they exercise? How do you get across their head? Should they stretch exercise? How often do you think?
Every day. Daily.
I tell my patients, do them, especially younger patients, sometimes they take them a second. I tell them, do your exercise on the days that end with Y, which is every day. So sometimes they'll come in like, you do my stretches on Monday, on Thursday, maybe Saturday. No, every day. The habit of doing something allows your body to change, as we all know, over time to better normal, and just maintain that. My best patient ones actually do their exercises, stretching, get healthy, and want to stay healthy. So when they come in, I tell them, now become your own best doctor. Now you know your body. Now you go, okay, when I'm off a little bit, what should I do? Go see the chiropractor. When I have this, blah, 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 it doesn't feel right, go see the chiropractor. Everyone has their problem, right? They feel sometimes just a tight neck, or just didn't sleep well, a little headache right over here, or just maybe some neuropathy down their fingers. They have their symptom. I go, that's your sign to call me Monday morning and get in that week. So I want to give them a way to gauge after I see them for, say, a number of visits, whatever it is, when they feel good. I'm putting on, I call it somewhat maintenance, I guess. When you feel that better, that point, when you don't feel that better anymore, let's get you treated right away. That point, you maintain that better again, so you don't go back to default where we were before, where it was painful all the time. Affected your mood, everything else. So I want them to understand, as we all do, what chiropractic is. It's a lifestyle choice to keep your body healthy for the rest of your life. And you're going to have problems. You all have problems all the time. Everything's going to happen. Go see your chiropractor first. All right? That's the key, I think, for all of us. Any questions at all? Yes?
I don't have a question.
Yeah.
I just have a comment. I
Sure.
was in private practice in Laguna Hills, California, and most of my patients were retired. I would say 60% of my patients were over 70, some
Yes.
up to 90. And the ones that lived and had the healthiest life were the ones that took the least amount of medications, but also were active in life, stretching, flexibility, yoga classes, going walking, just being happy and doing things, golfing. A lot of them, if they couldn't golf, that was the end of the world, so they would come to the
End of the life. Lost 3 strokes today. Take care of me, doc.
Yeah.
But it's having that habit of doing something every day, activity. Some people have no idea what that is. So you almost have to take them from where they are and slowly build up a routine. I don't have it on here. I have to do some more videos. I'll walk with the patient the first day and give them a couple stretches. Feels good? At that point, let's do some exercises. Let's go for a walk. I tell them 10 minutes only. Feels good? Add 5 minutes every day. But get them to a routine of feeling good with your adjustment, exercise, feel better. Adjustment, exercise, feel better. At that point, they realize, if I don't do the exercise every day, stretch every day, I may not feel better tomorrow. So having the habit of doing it every day allows them to realize that lifestyle choice gives them the ability to feel better tomorrow, next week, next month, next year. And also, same thing too, is having people around you with the same mindset too. I think that's the key for a lot of us. I always tell them, okay, you're walking now. Do you belong to a walking group? do you go to the gym? Who do you work out with if you have a workout partner? At that point, having that accountability, I think, also is important. So they have their groups to go, if I don't walk, Johnny's going to call me to go, hey, what's wrong with you? Get out here. Let's go. Sarah's going to go, hey, we were at the gym at 5 o'clock. Where were you? Are you okay? So having that accountability, or even as your chiropractor, when I see him next visit, I go, how'd the exercises go? I do them. I go, then why are you here? I can't help you if you know your own health. So knowing that, I know Sarah, when she comes in on Tuesday, she has to make sure she does her exercises, walk 10 minutes, did maybe 5 minutes of rowing because her back's really bad right now. At that point, how'd the 5 minutes go? In my head, I have a file cabinet of every patient in my head for some reason. I can't remember to pick up milk on the way home, but I can remember every patient's information. At that point, I go, when I walk in the room, I go, how'd it go with this, this, this? They go, oh, he's paying attention. At that point, they're accountable until they feel better. They go, actually, doc, it really helped. What else can I do? Once I hear the words, what else can I do, or a phrase like that, and now I got them to where now they realize their health is better because they're doing something for their own self. So that's a great, I want to call it just an observation of how people can stay healthy. Do we promote health with our patients? Not just the adjustment? We should. We do. If we don't, we're missing that part of their lifestyle that got them to come in. All right? Anything else? Comments, questions, concerns? Was it okay, or give me a thumbs down? All right, fine. Thank you, guys. Appreciate it. Thank you.